Okay, so here's the IVF stimming question we're going to tackle in this quickie video. What if your baseline ultrasound shows a cyst at the start of your IVF cycle? Wah, wah.
Ooh.
Here's your answer. It depends. Ovarian cysts at baseline ultrasounds are not at all uncommon. In one study, 17% of people who were going to start IUIs had them. That's nearly 1 in 5 people. Now, functional cysts are by far the most common type of cysts that are found on ultrasounds, and they're just leftover cysts from the follicles that were growing in the months prior. These cysts, a lot of times, are actually no big deal, but other times they're still giving off some estradiol or E2. And if it's high enough, that can decrease your response to stimming or FSH meds in IVF. So if you have a cyst, and they do your blood work and your estrogen, your E2 specifically, level is low, under 100 picograms per milliliter, then it's actually fine to keep going and stimming. It probably won't matter. But if your E2 is over 100 picograms per milliliter, it's probably worth pausing a cycle and waiting for that cyst to go away. Now, cysts should naturally just fade away in 2 to 4 weeks, and despite what the internet might tell you, there's not a good way to shrink them really quick once they're there, besides giving them some time. Now, aspiration, that's fancy for when your doctor sticks a needle in a cyst and drains it. That's not supported by the research either. It won't hurt to add some pelvic blood flow therapies in this window, like acupuncture, castor packs, or TENS unit stimulation. But still, time is your main answer here, and you're using these things in the hopes of improving circulation for when you do start your cycle, not because you're banking on it speeding up the cyst going away. Now, if you tend to have a lot of cysts often, then going on birth control before your IVF cycle can prevent those new cysts in the future cycles, but it won't treat the ones that are already there. So I hope this helps. Remember, keep your eye on the big picture here. I know it is super duper frustrating to have a setback right off the bat, but it's totally worth it to pause if it's going to up the number of eggs you can get and your overall IVF outcomes. While you're killing some time with this unwelcome setback, I'd love you to take a minute and check out my Banish Infertility Burnout 1-week mini course. It's the perfect way to make great use of this unexpected pause so that you can build yourself up a little bit instead of feeling beat down. So check it out. I'll put the link in the description.